చదువుకోండి. Okay, today we are going to talk about immunodiagnosis. So, any infection can be identified as per the Koch's postulates. It should be grown in pure culture, and once it's grown in pure culture, we get an antigen. The bacteria itself is an antigen. So, when man gets infected, he develops antibodies. So, an antigen-antibody reaction in observable manner, it is called as serological test. There are different kinds of serological tests. The serological tests are agglutination test, precipitation test, complement fixation test, neutralization test, enzyme-linked immunosorbent assay, radioimmunoassay. These are all molecular diagnosis, RT-PCR. So there are various kinds of tests which are employed for the diagnosis of immunodiagnosis. So these are called as serological tests because serum is used. What is the difference between serum and plasma? Yeah, very good. So without clotting factor is serum or plasma? What? Serum. Okay. Now, what is the difference between agglutination test and precipitation test? What is the difference between agglutination test and precipitation test? Okay. Please remember. Repeat with me. Agglutination, antigen will be in particulate nature. Agglutination is good in detecting antibodies. Precipitation, antigen is in soluble nature. And it is good in detecting antigen. These are the main two. So agglutination, particulate antigen. Repeat, agglutination, particulate antigen, precipitation, soluble antigen. Agglutination, why you are laughing? Agglutination, it's funny, isn't it? What? Agglutination. What is this nonsense he is teaching? Agglutination and precipitation. It's a lot of importance when you become a clinician, okay? You don't know what to ask for, what investigation you ask when you come across a patient with fever, okay? What is fever? What is fever? What is the normal body temperature? What is normal body temperature?
98 degrees.
Huh?
98 degrees Fahrenheit.
What is hyperpyrexia? You have seen thermometer? What is your name? Remove this mask. Huh? Homer. Oh. What is the normal body temperature? 90. Okay, what is Celsius? We'll be up there, 37, 90. Celsius and Fahrenheit, okay. Thermometer you have seen? Okay, where is it kept? Thermometer to mouth, where? In mouth. So big mouth is there. Below the tongue. Why not above the tongue? Why? What's it? Remove that mask. Why you are? Okay. What is your name and what is your name? Chandru. Jagdish and Chandru. After putting in Chandru's mouth, I record the temperature. Then I want to put in Jagdish's mouth. In between, how do you sterilize the thermometer? Oh. What is your name? Looks funny, isn't it? It is not my job. I am going to become a doctor. No? Yeah. Jagdish and Chandru, tell the answer. How do you sterilize thermometer in between the patients? What's your name? Vishnuvardhan. Okay. So it has to be sterilized with spirit. Okay. So now antigen antibody reaction, when it is done for the diagnosis, we come across a lot of problem in the laboratory. So what is the problem is antigen. This is usually shown as antigen, Y-shaped, a pair of heavy. Everybody. Immunoglobulin is made up of a pair of heavy chain, pair of light chain, held together by James Bond, disulfide bond. So IgG has got two antigen combining sites. IgG has got two antigen combining site. IgA has got four. IgA has got how many antigen combining site? Four. IGM has got how many? 10. IG has got how many? IG has got 2. IgD has got 2. IG has got how many? So repeat with me. IgG has got 2 antigen combining site. IgA has got 4. How many? 4. Balaji, listening? Jai Balaji, bolo. 4. IGM has got 10. 10. IG has got 2. IGD has got 2. Okay. These are called antigen combining sites. These are called antigen combining site. Whereas antigen can combine here. It can combine anywhere it wants. So like how boyfriend and girlfriend meets and they can combine anywhere like that, no? Laughing, what? Experienced. It is called multivalent. Antigen is multivalent, not talent. Multivalent. Whereas, repeat. Whereas IgG is bivalent. IgA has got quadrivalent. The IGM has got 10, that is pentavalent. Penta means 5 into 2, 10. IGM and IgD is 2, 2. Dual. Bivalent. So here it is multivalent. It can combine. The site where antigen antibody combine is called as what? What is a site where antigen antibody combine? Whether it is a park, whether it is a classroom, whether it is a, what is the name it is given? Where antigen and what is it? Where antigen combine with antibody is called as epitope. Epitope. It is called as epitope. Very good. Epitope. The site where antigen combines with antibody is called as epitope. Not all antigen will combine. Antigen will combine on the surface, one particular molecule. This thing is called epitope. This particular molecule is called epitope. Okay. The firmness, hold like this. Hold. Nothing wrong. When you become old, when you are in ICU bed, you will remember this. Oh, this was taught in the class. The firmness, everybody, the firmness with antigen combined with antibody is called as avidity. Avidity is defined as the firmness with antigen antibody combine. Okay, now antigen antibody combination can be reversible. Antigen antibody reaction can be reversible. Everybody. The breakup can happen without alteration of psychological factor. Nothing will happen to antigen, neither antigen, antibody. How many breakups you had in the past? No breakups. The breakup is very glorified nowadays in movies, isn't it? Ashik, main Ashik banaya. What? Okay. Now, so IGM is predominant antibody in agglutination. Right now, everybody say IGM is a predominant antibody which participates in the agglutination test. Whereas IgG is a participant in the precipitation reaction. Now, IgG is predominantly intravascular in distribution. Everybody, IgG predominant in intravascular distribution. It protects the bloodstream from infection. Whereas IgG is the most common antibody, presents both intravascularly as well as extravascularly. It's the only antibody which causes the placental barrier. Chalo. Now what problem we come across during antigen antibody reaction is, which we always do in good electrolyte fluid and other things, and now there is something called prozone, zone of equivalence, and post-zone phenomena. Prozone, zone of equivalence, and post-zone. Everybody repeat. Prozone, zone of equivalence, postzone. What is prozone? Antibody axis. When antibodies are large in number, it is called as prozone. Prozone, antibody axis. Everybody, prozone, antibody axis. Prozone, antibody axis. Prozone, antibody axis. Postzone, antigen axis. Postzone, antigen axis. In the zone of equivalence, all the antigen antibody combining sites are fulfilled and there is a good lattice formation. So diagrammatically represent. So antibody, we said it is the bivalent and antigen is multivalent. So there are lot of antibodies which are not combining with the antigen. This is antibody axis. Now coming to zone of equivalence. So all the sites, these are the antigens. Good formation of lattice. Good formation. All you see very well the antigen antibody reaction. Whereas in post zone, you have a lot of antigens which do not get enough antibodies. So once again I repeat, prozone, antibody axis, zone of equivalence, antigen antibodies, all the sites satisfied and good lattice formation, and post zone, this is an antigen axis. Okay, so good antigen antibody reaction usually see in good antigen antibody in the zone of equivalence. Next, definition of titer, T-I-T-R-E. In your PUC classes you must have done with burette and pipette, this beaker and all those things. Go on adding something, acid alkali mixture or something like that. Titer is defined as highest dilution of serum in which antigen antibody reacts in observable manner. 5 times. Titer is defined as highest dilution of serum in which antigen antibody reacts in observable manner. For example, if you are diluting serum 1 in 2, 1 in 4, 1 in 8, 1 in 16 and there is no agglutination in 1 in 32, what is the titer? 1 in 2, 1 in 4, 1 in 8, 1 in 16, 1 in 32 and you don't see agglutination in 1 in 32, you see agglutination in 1 in 16. What is the titer? Why? It's not a rocket science. 1 in 16, 1 in 32 you are not seeing the agglutination. 1 in 16 is a titer. So once again, highest dilution of serum, you see agglutination in observable manner. Today we are studying agglutination test and liquid chromatography. That is card liquid chromatography test, which will be shown to you in the practical class. Okay, now I said agglutination test. There are 5 slide agglutination tests. How many? 5. How many? 5. 5 agglutination tests. Number 1 is blood grouping. Number 2 is RH typing. Third one is major cross matching. Fourth one is minor cross matching. Fifth one is isolate identified by specific anti-serum. So repeat with me. Blood grouping. Who discovered blood grouping? Carl Landsteiner in 1900. It was passion of man to. Is the higher considered the highest dilution on this earth. Blood, flood, money, knowledge are meant for circulation. It should not be hoarded. So you should educate. Education is empowerment. Knowledge is empowerment. You can donate money, you can donate anything, but we have yet to create an artificial blood. You must be seeing that person running pillar to post for want of B negative, A negative, O negative blood. So it's considered as highest form of donation. How many of you have donated blood until now? Nobody has donated. Balaji ji, how many times? Only one time. Right from second year, I made a habit of donating blood. I donated 43 times. Okay, and earlier part of career, I was in MS Ramaya Medical College. Must have heard of this college name, MSRMC, and I motivated student. We got the highest donation on a single day. But unfortunately, that time cell separators and platelet concentrate, all those high-end things were not there. Now one bottle of blood can salvage. You can give plasma, you can give platelets, you can give blood packed cells. You can salvage 3 lives. So just remember, somebody died for want of blood. So blood grouping, RH typing, major cross matching. Major cross matching is take the donor's blood, add to the recipient, and whereas recipient blood to the donor cell, donor's plasma. So isolate identification, we isolate some organism, we have S typhi, we have anti-serum against S typhi, and look for agglutination. So these are the 5. Now tube agglutination test, very important is Vidal test. Next is Brussels agglutination test. Third one is Wheel Felix test. Vidal test is done for the diagnosis of typhoid fever or enteric fever. This is the first test which we started doing agglutination test. Brussels agglutination. Brucella is one of the zoonotic disease. Zoonotic diseases. What comes to your mind? Zoonotic disease. What are diseases that come to your mind? Zoonotic diseases. Which one? Swine flu. Swine flu, you cannot say it's a genetic reassortment between pig virus and human virus. So we call it as genetic reassortment in the environment. Swine flu, it's not a zoonotic disease as such. So avian flu, swine flu. Chandruji, boliye. Zoonotic disease, so many common. There's a whole chapter on zoonotic disease for you. It's a disease of animal, man get accidentally infected. First that comes to your mind should be rabies. Rabies is one of the things you remember, all of you, is a dead end disease. Once you get infected, once you have a symptoms, the goes and attaches to the neuron, nothing can salvage you. Death is certain. And they have a miserable death. They are thrown in one corner because Small amount of light, water, food gives multiple convulsion. Finally, they die of acute respiratory distress or failure. So be careful with the dogs. Most of the students, what they do is they will kick the sleeping dog. To protect itself, it will bite. So I've done 100 of anti-rabies vaccines. Most of these students, especially who go on bike, especially to show they're powerful, they usually bite. Usually they, especially if they're going on Yamaha or bikes, especially with their girlfriends in the back, they'll just show they want to show they are hero. They just kick the dog, and dog will definitely bite. Next, just now I told brucellosis is zoonotic disease. Man get infected by by drinking unpasteurized milk. Unpasteurized. What are the methods of pasteurization? Pasteurization. There are two methods of pasteurization. One is Holder's method, another is flash method. What are the milk-borne disease? If you drink milk which is not pasteurized, what all infections you get? It's not rocket science. It's even a layman knows. You should not drink raw milk, isn't it? What all infections you get by drinking? So one of them will tell you. One of them, there are so many: poliomyelitis, infective hepatitis, S. typhi, bovine tuberculosis, Q fever. There are so many. List of diseases. All waterborne diseases are milk-borne because milk is not pure. It's always mixed with water. Okay. Wheel Felix test is one of the rickettsial disease, and either they are flea-borne, fly-borne, or tick-borne. Flea, fly, and tick. So you must have seen, it usually occurs when people are congregated together, especially in army and other things. That's why they have tapori cut. You must have seen army soldiers. They will not have big hair. They will have small hair. Small hair. You must have seen some movies. So these are louse-borne, epidemic typhus, louse-borne. Tick-borne is endemic typhus. Okay. Typhus fever is skin exanthemata. They will have skin exanthemata. Next we do is what is called as MAT, microscopic agglutination test. Microscopic agglutination test, which we usually do for the diagnosis of leptospirosis. Anybody knows what is leptospirosis? Leptospirosis. Anybody heard of it? Leptospirosis usually occurs, especially in medical schools. It's very common in medical students. We had a large endemic of this leptospirosis, Mysore Medical College, where 70 postgraduates suddenly developed bacterial jaundice. So we went to know what is epidemiological triangle? Epidemiology. You know what is epidemiology means? Source, causative agent, and environment. Okay. Source you have to find out. Epidemiologists usually find out the source. So when we reached the top of the hostels, we saw a lot of bandicoots, rats dead. This organism is present in urine of the rats. When you take a bath in that water, it is notorious to pierce the unbroken skin and go to the liver and cause jaundice. So very important, especially we have to check your overhead tanks periodically, once in 3 months, once a couple of months, and adequately take care of. There is something called OSHA. You know what is OSHA? ASHA, you know? Any ASHA is there in this class? USHA? USHA is not there. ASHA, USHA, OSHA. OSHA is occupational safety in hospital administration. You are all admitted to medical college. It's the responsibility of us to take care of you until you pass your MBBS and complete your internship. You know what is ICTC? Long form of ICTC? Integrated Counseling and Testing Center. Okay. MAT we do for diagnosis of leptospirosis. Okay. Then we do what is called as Paul Bunnell test. Paul Bunnell test. Paul Bennell test we do for the diagnosis of infectious mononucleosis, glandular disease caused by Epstein-Barr virus. It's also associated with nasopharyngeal carcinoma and Burkitt's lymphoma. Nasopharyngeal carcinoma and Burkitt's lymphoma. And antigen we used is sheep RBCs. Okay, it is nicknamed as kissing disease. Nicknamed as big laugh, big smile on the face of Chandru. And it's very common in adolescence. What is adolescence, by the way? Teenage. Adolescence is teenage. And when you do a peripheral smear, it looks like lymphoma. Okay, a large amount of mononuclear cells. And then we do 2 tests for Microplasma pneumonia: Streptococcus Mg agglutination test and cold agglutination test. Cold agglutination test. This is done for diagnosis of Mycoplasma pneumonia. Mycoplasma pneumonia is a cell wall-less organism. It lacks cell walls and it is pleomorphic in nature. So these are very important. Then we do Coombs test. What is Coombs serum? Coombs test. Heard of Coombs test or no? Yes. What is it? What is Coombs serum? Coombs serum, everybody 10 times. Anti-human gamma globulin. Antibody to human antibody. Anti-globulin test or anti-human gamma globulin test. 10 times anti-human gamma globulin test. Anti-human gamma globulin test. Anti-human gamma globulin test. Anti-human gamma globulin test. If father is Rh positive, everybody, father is Rh positive, mother is Rh negative, invariably fetus will be Rh positive. First delivery will be uneventful, nothing will happen to the first child. Nothing will happen. Okay. During the trauma in the first delivery, cells of the fetus crosses the placental barrier, sensitize the immune system of the mother and give rise to anti-Rh antibodies. During the second pregnancy, again the fetus is Rh positive. These anti-Rh antibodies crosses the placental barrier, give rise to condition called as erythroblastosis fetalis. So what you will do that time? Now we have got a fantastic method to find out if the fetus in the mother's womb is undergoing RBCs are broken down. What do you do? Remove all Rh positive blood and fill it with Rh negative blood. This is called exchange transfusion. This is called exchange. So basically what is Coombs test? So Coombs test, you take O positive RBCs, 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 add mother serum suspected to be having anti-Rh antibodies. Although there is an antigen antibody reaction, but they are not observed because they are incomplete antibodies. These are incomplete antibodies. These are incomplete antibody. These are incomplete. Although there is an antigen antibody reaction, but they are not observed. Although there is an antigen antibody reaction, they are not observed because the antigen antibody reaction is not observable. To make it observable, you add AHG, that is called anti-human gamma globulin. Then what happens? Then there is agglutination. This is called indirect IDC, indirect Coombs test. It is called as indirect Coombs test. This is called indirect Coombs test. So a lot of people wants to become gynecologists in this class. Definitely will come across this this situation. Okay, when males are taking up gynecology. Now Coombs test is very commonly done. What is direct Coombs test? This stage is over in the fetus. Already the anti-RH antibodies have come and sensitized the RBCs. So what you do is take the cord blood cell, everybody, direct Coombs test, take the cord blood cell, add Coombs serum, there is agglutination. So we'll repeat once again. Take washed O group RBCs and take mother serum, suspect having anti-RH antibody. Everybody take the mother serum, suspected of having anti-RH antibody. Although there is a reaction, antigen antibody reaction, that is not observable because anti-RH antibodies are incomplete. Add Coombs serum. Coombs serum is nothing but anti-human gamma globulin. Then there will be agglutination. This is called indirect Coombs test. Direct Coombs test, the first stage is already over. Direct take cord blood cells, add Coombs serum, there will be agglutination. Okay, now conversion of precipitation test in agglutination test is called as converting precipitation into agglutination. This is usually done by tagging antigen, soluble antigen onto the particulate matter. The most commonly used particulate is latex, bentonite or RBCs, O group RBCs. Okay. So what are latex agglutination tests we usually do for in the clinical practice? ASO, CRP and RA. ASO stands for anti-streptolysin O. Anti-streptolysin O. The Streptococci is a gram-positive cocci arranged in chain. Why it is arranged in chain? Because it divides in single plane and daughter cells fail to separate out from mother cell. That's why it is arranged in chain. It produces two types of toxin, anti-streptolysin S, anti-streptolysin O. Oxygen labile and oxygen stable. So you take latex particle coated with ASO antigen, add serum. So the latex particles get agglutinated. CRP is C-reactive protein. It is like ESR. In all acute inflammatory condition, it's raised because we did during COVID all CRP to find out the prognosis as well as diagnostic CRP value. So C-reactive protein is again tagged onto the latex, and there will be add serum, there will be agglutination. Then RA is rheumatoid arthritis factor. It is a antibody produced against our own synovial membrane. Okay. Again CRP, RA is tagged onto the latex particle, add serum and look for the agglutination. That is RA factor. Then we have a card test for these things. Hepatitis B surface antigen. Hepatitis, there are two kinds of, hold like this. There are two kinds of hepatitis. Actually there are 5 types, but the important one are 2 types. One is infective hepatitis. The other one is serum hepatitis. Serum hepatitis is very dangerous. All of you are vaccinated or no? How many doses? 1 dose. You should have been completed 3 doses. You take 1 dose now, one after 1 month, another after 6 months. Every 5 years you have to take booster dose. It's one of the doctor's disease. 35 crore people are carrying this virus in their blood, equivalent to the population of the US. It's very, very important. So we, prior to the operation, we do serovirology for all these parameters. Hepatitis B, HCV is also called as post-transfusion hepatitis. It's raising up. HIV is sexually transmitted disease, blood-borne, vertical transmission, needle stick injury, and so many things. So this is called chromatography. We have cassettes like this. This is HIV1, HIV2. We'll tell you in detail about this chromatography when you take up HIV class. When you add serum, this is control. If it is positive, this also will show colors. HIV1 positive, it will show color. HCV is also, we have control, positive control, and it show color. HIV also, HIV1, the HBCG is 1 only. HIV 1 and 2 we quote. HIV1 and HIV2 is milder, HIV1 is severe. Now, the most is now arthropod-borne disease. Arthropod-borne disease means what? Arthropod-borne viruses. You have not heard arthropod? It's very, very increasing very much. So, there are mosquitoes in your hostel or no? Yes, sir. What do you do for mosquitoes? Good night, all night, bad night? What coil? Mosquito, tortoise coil. Odomos. So these are mosquito-borne disease. There are arthropod means 6-legged insects. It can be mosquito, it can be tick, it can be a flea or fly or something like that. So important arthropod-borne diseases present in India are Japanese bee encephalitis, Culex tritonorinctus, Kayasnur forest disease. This is a forest state, Karnataka state. There is a place called Shivamoga. There is a forest called Kayasnur. So monkeys are the reservoir host, and man get infected by the bite of tick called Haemosphysalis spinagera. There are 2 mosquito-borne diseases which are very prevalent in India are dengue. There are 4 species: dengue 1, dengue 2, dengue 3, dengue 4. DHS, dengue hemorrhagic fever. DSS, dengue shock syndrome. So what happens is there is an anti-platelet antibody formation. Anti-platelet antibodies. See, you are coming to the office in the morning, suddenly you develop fever. 3rd or 4th day when you do a platelet count, it will be less than 20,000. It starts, you have to get admitted in the ICU, and you take concentrate of platelets. You need at least about 10 to 12 platelet first until it comes more than 1 lakh or something like that. Sometimes there will be bleeding from everywhere, where they put vivula and catheter, nasogastric tube and all this. Some people die of dengue shock syndrome. So dengue is caused by mosquito Aedes aegypti. Unfortunately, it bites in the daylight, and it is present in the stagnant water in the flower pot, not Deepavali flower pot, pots in which you grow flower in the garden. So we have a dengue kit. It shows NS1 antigen on the first or second, third day of the infection. The card looks like this, big card like this. It shows NS1 antigen and IGM antibody. IGM antibody. Which is the acute antibody? Which is the acute antibody? Which antibody appears immediately after infection? Hey. IGM, 10 times IGM, acute antibody, IGM, acute antibody, IGM, acute antibody. Time I am also, I have got a watch. I am also seeing. I know you are tired, dead tired. You want to have a cup of coffee after going here, and you have to do some chatting and go to the Facebook, see all WhatsApp messages, what you got morning to evening, and reply them. And you have to, some nice jokes would have come. You have to say very nice and all that. Show thumbs up like this and all that. I know that. Only thing is, our time there was no phones also. We used to do it on landline. So we used to have a connect call. We used to go and wait in the, sometimes it used to take 6 to 8 hours to contact somebody. In our time it's only letters. So now mobile usage is rampant, and especially don't get addicted to the mobile games. So psychiatrically it's proved that once you get addicted, you become psychiatrically ill. Okay, you know that 10% depression among the medical students. If there are 100 students in class, so 10% get depressed by the end of their school of medicine. Okay, it's a very well studied, and one of the toughest course among all the courses is medical education. Considered as the very toughest course, very difficult to analyze, read and reproduce. We have multiple examinations. It's a long study to undergo and all those things. So dengue fever, and one more is chikungunya. Chikungunya also caused by arbovirus. Any idea why it is called chikungunya? Man get infected by eating chicken. Am I right? Your smile is very good. All the time smiling. And what's your name? What's your name? Huh? Usha. Oh, I was just asking Asha, Usha, Nisha. You did not say, I did not raise hand. Usha. Very nice. Chikungunya is called chikungunya because of arthritis and back pain. Man becomes like chicken. Man becomes like chicken. That's why it's called as chikungunya. You heard of chicken pox? By eating chicken you get it? Yes, sir. Balaji, Maruti. What is chicken pox? I'm missing Maruti. Very what? Sad, huh? Why Maruti? Why you are so? Breakup, huh? Maruti ji, boliye. Chicken pox is caused by which virus? Chicken, huh? No. What is the virus which causes chicken pox? Varicella zoster, VZ virus. Varicella zoster. Any idea why it is called chicken pox? What? You say something? Huh? In olden days, when there was no treatment for penicillin, the secondary syphilis, when it used to attack mucocutaneous area, it is big exanthemata on the skin. It was called big pox. Syphilis is caused by Which organism causes syphilis? Trypos means? Trypos means what? Trypos means curd. Oh, everybody do it like this. La 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 la. Trypos means curved. All curves are bad, isn't it? Do you agree with me or not? What curve you are thinking? I am talking about road curves. You are thinking other curve already. Okay. Treponema pallidum. It is called pallidum because it stains pale. Treponema pallidum. It stains pale. It stains pale. Okay. And what is TTD? Tirupala Tirupati Devasthana. Laddus have become very costly, isn't it? How much it costs now? 201 laddu. Very costly. I am talking about transmitted diseases. What are the transmitted diseases? Blood transfusion transmitted diseases. Blood transfusion, HIV, very good. Then hepatitis B. Then HCV, cross transfusion hepatitis. HCV, syphilis, malaria, cytomegalovirus. These are called TTDs, transmitted diseases. What are vertical transmission, mother to child transmission? Vertical transmitted diseases. Vertical transmission. You remember with mnemonic, torch, not torch. More torch also is there. Storch. S for syphilis. S for caused by Treponema pallidum. T for Toxoplasma gondii. It's a parasitic infection. We'll tell you in detail. The oocytes are present in the feces of the cat. Man get infected when when cat's feces contaminates the man's food. Especially they should be away from the cat, especially during pregnancy, first trimester. Child will be born with mental retardation, deafness and blindness. Very difficult to. Who is mnemonic? Rubella. Rubella is commonly called as German measles. It is also the CRS, congenital rubella syndrome, again deafness, blindness and mental retardation. Then hepatitis B, hepatitis C and herpes. Herpes simplex 2. Herpes simplex 1 is orofacial, hepatitis 2 is genital. These are called vertical transmitted infection. Mother to child transmission diseases are storch. So please remember the importance. So diagnostic agglutination tests, slide are 5. Hold it like this. 5. Blood grouping, RS typing, major cross matching, minor cross matching, and isolate identification with specific antiserum. Tube agglutination, Vidal test for typhoid fever, Brucella agglutination test for brucellosis. What happened? Sleeping. Brucella agglutination for brucellosis. Everybody. Manasa, sleeping. Brucella agglutination test for brucellosis. Wheel Felix for typhus fever caused by rickettsia. Paul Burnell test for infectious mononucleosis. MAT for leptospirosis. MAT stands for microscopic agglutination test. Then Streptococcus MG agglutination test. Then cold agglutination test for Microplasma pneumonia. Then TPHA, Treponema pallidum hemagglutination test for syphilis, specific test for syphilis. Then Coombs test for incomplete Rh antibodies. Latex agglutination tests are RA, ASO, CRP. Then dengue, you have got a card test. Then chromatographic tests are, card tests are hepatitis B, HIV, HCV. So we'll demonstrate ASLO and this thing in practical class.